Okay, we're on the podcast now with Dr. Brad Schaeffer, and we're going to talk about all kinds of questions about feet health for runners. Maybe I should say foot health. I don't know. Something like that. Dr. Brad, welcome to the MTA podcast.
Thank you. Appreciate it. Thanks for having me.
So what got you interested in becoming a podiatrist and a foot and ankle surgeon? I mean, feet are something that people either, sometimes have kind of shy away from. It's an interesting specialty.
For sure. Well, for the most part of my life, I always wanted to be in medicine, be a doctor, surgeon, things like that. But being a surgeon sometimes takes you away from family and the quality of life, at least that I was looking for. So, like coming up through, I saw that feet and other forms of medicine didn't necessarily have that much time restrictions, and also were dedicated to, office and surgery and things like that. So I was never grossed out with feet. Never found feet sexy. So I was like, okay, it's a good mix for me. It gives me a nice balance. So I'm not straight either way. But yeah, you're right. You're right for sure. Like people find feet just so fascinating, and I like the foot game always around. So whatever your thing.
I feel like runners can handle like gross feet pictures because, occasionally people post their toenails or, some kind of bunion
Yes.
they've got or blister or callus or, whatever the issue. And I feel like,
Yeah.
runners can usually hang with the feet stuff because
Yeah, we talk about a lot of worse stuff than that.
Sure. Yeah.
and
Runners and hikers. Oof.
Yeah.
They're hard on their feet. That's why
So
they need us.
Yep.
Speaking of gross foot stuff, there's some really gnarly feet problems on the show. My feet are killing me.
Yes.
I've been watching
Yes.
clips. Maybe some listeners haven't seen the show or heard of the show. Can you give us some examples of some of the more extreme things that you've seen on the show there?
Absolutely. Yeah. So TLC, My Feet Are Killing Me. It's a great show. Really just kind of showcases, the people out there that sometimes can't really find help in their area or doctors that are willing to treat them. So we always say on the show, it's very easy to cover up your pain and shame with feet because, you can throw on a sock and shoe and kind of forget it. No one on the outside world sees that you're having all this pain and embarrassing issues. Like we treat crazy bunions, that are just completely off to the side, like 90-degree angles where people can't even walk anymore. Arthritic deformities where, again, like the kind of front of the foot is mangled, creating hammer toes and pain with the bones, to anywhere from just like really crazy toenail fungus that like people just have not washed their feet or taken care of their toenails for sometimes years. And again, it's really just, time, fear, and money for the most part. So we do everything on the show pro bono, take a lot of care and time dedicated to the patient's well-being. And we like to say they walk in our office and then walk out with pain, without pain. So we love it. The show's great.
Wow.
That's really cool. And we were talking about doing this episode. Trevor was showing me some pictures. I think he was trying to gross me out, but I'm a registered nurse.
Yeah.
And I, was telling him like we had some pretty gnarly, especially diabetic feet that would come in through the hospital, often
Yeah.
just neglected for years. And it would be so sad. And I said, it's not necessarily the looks of it, it's the smell sometimes. So maybe you can
Yeah.
chime in there.
So that's the one thing that I say, like, everyone's like, oh, how can you do that? And again, like I've never had a problem with feet, but the smell, and especially the smell of like infection,
Mm.
the smell of infection is bananas. So that is one thing that I've had a problem with, but you can do like different tricks. You can plug your nose. You can put like Vicks under there so you can get through it, but nah, it sucks.
You learn to breathe through your mouth a lot.
Oh, man.
About anyone says that they can deal with that is lying.
Mm-hmm.
Wow. Yeah. Isn't there an episode called A Smell from Hell?
That's possible, and that might be one of the ones that my colleague on the show treated. But I was so glad I did not get this one because, unfortunately, the person that she was treating, I think this is the same one, but the patient literally showered with socks and shoes on.
Wow.
Yeah, so for whatever reason, I don't know what, but she had the like candles, all doors were open. Like I heard that was a really rough consult.
Wow.
So yeah,
You
shout out
remember
to
what was
Dr.
going
Ebony
on?
for that
Like
one.
just really bad toenail fungus, or
Again, I think a lot of stuffs can boil down to mental health,
mm,
Hmm.
and different things that's affecting one. And I don't know that exact one. Again, I didn't treat it, but when I was watching it, I was pretty shocked myself.
Yep.
mm,
And
So
sometimes it's
yeah,
mobility issues too. Like people can't take care of their feet because they can't access their feet and reach them very well.
well
So
said.
there's, a lot of different things that go
Yeah,
into it, but
mm.
yeah.
weight. Yeah, crazy for sure.
Fortunately, runners
That's
usually
why
are
that's why
pretty
you
on
have
top of their
us.
feet. It's like if your feet are hurting you, if you're having pain, then it literally prevents you from running like you want. And so often, I think runners tend to be like really on top of their issues. They're like, okay, I've got to find a solution now to this thing and not let it get worse.
Yeah.
Yeah, as someone that's into health and wellness and probably is out there running and doing things like that, they're in tune to their body for the most part. So, like foot health awareness and things like that we're constantly educating people on. Yeah, it's the foot checks. It's, every step that you take, checking that you have proper shoe gear, proper insoles in your shoes, whether that be like Dr. Scholl's or orthotics. You know, all this stuff is so important and it's easy. Like you just take time, go to a proper running store, get fitted, see a proper podiatrist, get x-rays. It's really just like a couple hours out of your life to make sure you're on the right track.
Excellent. And when we told our audience that we were going to have a podiatrist on the podcast, people were really excited, and we gathered up some questions. These are from Academy members, and there was quite a few questions about heel pain. So, what are some common causes of heel pain?
Yeah, so heel pain is probably one of the most common things that we treat. The heel can either be on the bottom with it, which is like plantar fasciitis type stuff, or the heel can go around the back where your Achilles attaches. That's also heel pain too, and that can be Achilles tendonitis. And that heel is called your calcaneus. So, I just can you guys still see me?
Hmm. Yep.
Yes.
My screensaver just popped on. I'm back. Okay. So yeah, so it's either plantar fasciitis, Achilles tendonitis, and a lot of people have pain there. And really, it's like heel strike. That's the first thing that hits the ground. So when we're walking, running, that takes a lot of pounding. So really, the main thing that I tell people to avoid both of those things is stretch. Like our stretch game has to be on point because that calf goes right down into the Achilles, right down into your calcaneus, and then right across to your plantar fascia. And if that area becomes tight, everything pulls and creates inflammation. So if you stretch, then get proper shoes, support your feet, you know, alleviate the pressure on the arch, and that alleviates everything from the heel. So everyone out there, you have heel pain, it's stretch, shoes, insoles,
And like you said, prevention is so important because once you get into a
everything.
cycle of plantar fasciitis, it can be so difficult to get rid of, especially, if as
Yes.
a runner, you don't want to stop running necessarily, and it can be very painful. And I totally agree with what you said about the proper shoes. I've found, especially as I've gotten into my 40s, that I cannot wear the cheap, flip flops, just, slip on shoes anymore. I have to have good arch support, like a good recovery sandal is so
What do you wear?
important. I like OOFOS a lot.
Yeah, they're solid.
Mhm.
Yeah,
Yeah.
they really came out with a nice recovery sandal for sure.
Mhm.
Is there something that you recommend?
Yeah, I was wondering what kind of things that you like for.
Well, I like that for a recovery sandal.
Mhm.
Also, Bionic has a good recovery sandal. If we're talking about that, Dr. Scholl's is coming out with a really good recovery sandal. I do a lot with them. As far as shoes are concerned, uh, I personally like work out in like Hoka, or there's another company called MBT,
Mhm.
which is really solid. It really just is like a offloading type of shoe that I feel like every step you take can propel you forward. Really just
Mm.
helps me when I'm running.
Yeah, that
So I
makes
like
sense.
those. I like those two a lot. I used to rock with Brooks a lot.
Mhm.
The Ghost or Adrenalines that they used to be my favorite. But yeah, probably more like Hoka Clifton or MBT right now.
That's
Nice.
cool. So if someone's in like a really bad cycle of plantar fasciitis right now, so they're playing catch up, they're, hopefully stretching, they're hopefully wearing proper footwear. What about things like the night splints, cortisone injections? Like what are the next steps if they feel like they're trying to play catch up?
Sure. So once you're having that shooting pain in your heel and just say like stretching insoles, shoes, it's not really working, you really just have to get first x-ray because you don't know what's going on in there. Just go to your doctor, check that out. And then usually it's a discussion on cortisone injection with maybe like anti-inflammatories. So that could be like ibuprofen, Aleve, different things like that, just to get the inflammation out. Cortisone injections, usually it's like a series of three. In our office, we do a lot of alternative stuff. So, like, you can do laser therapy to stimulate blood flow to the area if you're not like a fan of cortisone and the steroid techniques and things like that. Sometimes people feel like that's a band aid on a problem. And I don't necessarily disagree, but it does help, get you over the hump. Um, Platelet-rich plasma has been a game changer for a lot of people. I know, like, I'm a baseball player, so a lot of pitchers get that in shoulders, knees, things like that, but it really works well for the feet. And platelet-rich plasma, that's your blood, spun in a centrifuge. It's no one else's stuff. So that's kind of like the more regenerative approach that we do for our runners and athletes. Again, laser therapy. But cortisone has always been gold standard,
Yeah.
for sure.
Hmm.
So we had a question about Morton's neuroma, like how people deal with that. And that can be, again, another really painful issue. I think the person who was asking the question was trying to avoid getting surgery to have it removed. So,
Yeah, maybe start with
Yeah.
what is Morton's neuroma?
mhm.
Sure. Well, Morton's neuroma is something that I have. I have it in my left foot, and it's an inflamed nerve that most commonly converges in the inner space between toes 3 and 4. It's in the ball of the foot. Sometimes you're feeling like you're walking on a rolled up sock. It can be super annoying. Numbness, sometimes pain. Uh, I hated having it. And the way I fixed myself was I started with the same thing: cortisone injections. Orthotics were a game changer with a met pad to alleviate the pressure from the ball of the foot. That was one of the main things that helped me. But honestly, not working out like a bonehead, not doing explosive exercises and pounding that area so much. I used to do a lot of plyo. So I used to like explode up, jump down, and all that pounding really just messed up my nerves and the ball of my foot. So, in my opinion, I don't do neuroma surgery. I'm not shaming anyone's game that does it, but I'm not a fan of it because like you're literally ripping out the nerves in that area. So not for me. But there are other ways. There are other ways to treat it, and I would exhaust all options before that. There's cryosurgery, PRP injections, um, dehydrated alcohol. You can do. I did that. That really worked well. So there's stuff. There's definitely stuff out there.
So get with your podiatrist and start troubleshooting it. And
Yeah, but a lot of podiatrists are just going to shoot it with cortisone, and you can't blow that area out too much. So
Mhm.
if you don't have a podiatrist that's like into other forms, you might feel lost, and
Mhm.
then you'll need to have another consult with another doctor. Like not everyone has everything at their disposal. It's just not
Exactly, and
the
I
way things
find that,
are.
like, a lot of people who don't work with athletes, it's like, "Oh, stop running." And obviously for a
Yeah,
short time,
right.
that's necessary for acute injuries, but it's not like a lifetime, you know,
No,
cure for most
I
people.
would
They're not
never.
willing to give up
Yeah,
their athletic endeavors. So,
sure.
Mhm.
finding a good fit, like
I'd
you
never
said.
tell people to stop doing that or
Mhm.
stop doing what they love. So like you start with like the insoles, with the Met pad, with the rocker bottom shoes to run with. Like Hoka started it for the most part. I don't know if they started it, but it certainly blew up once they did it. But like there are ways to get you on the right track and offload the front of that foot. You just have to offload the front of the foot.
Mm.
And again, like once you get in that cycle, you have to break the cycle, stimulate the regeneration and then the healing. But you can't fall into your old behaviors.
Right. Exactly. You have to be, to be
Yeah.
doing the follow-up with it to prevent it from going
Yes.
backwards. That's a good point.
Because it'll come back. It'll come right back.
Mm-hmm.
Okay, let's talk about Achilles tendonitis, something I've had in the past. This is from Cindy.
Yeah.
She says, any advice for treating chronic Achilles tendonitis issues and tips for running and training for races to prevent flare-ups?
Sure. So that's something that, a lot of people get because that's a main tendon in our body. It's really just all of our push off. So it's stretching. Make sure your stretch game is uh, paramount to your activity before and after a run and race. A lot of people will just like brush over that. Like, yeah, they'll stretch, but they won't stretch. Like, you have to stretch. Take time to do that before and after. I know you're tired after, but it's important. Um, when that becomes inflamed, it's okay to take anti-inflammatories from time to time. Like that's not crazy. It's not going to hurt you. The overuse, of things like that aren't the best. Like I don't overuse it, but from time to time, it's okay. Again, the shoes that we were talking about, the insoles are super important when it comes to that. And if you have something that's chronic, it's not going to get better with the things that we're talking about. It's just not. So you have to stimulate the regeneration of that area. And that's with laser therapy and PRP, stem cells, amnio injections, things like that. But we do PRP. Again, that's platelet-rich plasma. It's your blood spun in a centrifuge and injected in that area. And it stimulates the healing of that tendon. You have to go from chronic to acute to heal, right? So if something's chronic, you're not gonna get it healed.
Mm.
You have to jumpstart that kitty.
Yeah, good point.
Is that very common? PRP? Do a lot of podiatrists do that?
It's a good question. I'd say some do some form of regeneration. So that's like PRP. You need to buy a centrifuge. You need to have someone in your office that's able to take the blood. Stem cells you can buy, keep it in a fridge and inject it. Amnio injections, things like that, doesn't require all the things. I think PRP is the best. That's why I took time to get the machine, be able to spin it, hire staff that's able to take the blood, things like that.
Wow.
So some people were asking that if foot issues tend to stem from issues higher up the kinetic chain. So do you find that if people have problems with like knee issues, calf issues, that they end up eventually getting ankle foot issues?
I do. I feel it's all just overcompensating. So if I'll do surgery, like if I'll do bunion surgery on somebody, like I'm saying to that person, you should probably get your next foot fixed within 6 months because you're throwing off your gait. And I do. I feel like it all corresponds.
So do you recommend physical therapy for people? I know there's certain, physical therapists who will do like gait analysis. I've been to one, they put like sensors in my shoes and like tape me up and put me on a treadmill just to kind of see like how I was landing and, where the weaknesses are. Like how valuable do you think that is for people?
I think it's all solid, and it's all something that's nice to have in our back pocket. Um, I've been out like 10 years now, and I don't have like those modalities in my office, and I seem to like get people better and happy. So I haven't necessarily needed it, but I have seen, where people have that, and it's so cool to watch like every step that you take where you need to offload it and things like that. Highly, highly, highly specialized. So I think it's 10 out of 10. You find somebody that has that, that's fantastic. Cheers. Not everybody has that.
Yeah, again, finding the right fit for your specific need and getting that can be sometimes a little bit of a challenge. You have to shop around a little bit and figure out
For
a good
sure.
fit for a provider.
And your office is in New York City, or where?
Yes. Yeah, it's the Upper West Side in New York City. It's on 85th and Central Park West.
Nice.
So if you're ever here, go for a run and park together.
Yeah, that would be awesome.
Yeah.
Okay, how about let's talk about arch pain and inserts. Here's a question from Meg. She says, I have arch pain in my left foot after about 12 miles. I've been told I have high arches, but any off the shelf insert just doesn't seem to be right. Are custom supports worth it? It's not horrible pain, it's just annoying. So, custom inserts. Thoughts?
Yeah, so custom inserts are called orthotics. I do a ton of that. And again, like that's what helped me with my Morton's neuroma, ball of the foot pad, alleviated my nerve area there. I think they're game changers for anybody. I think like baseline, you can do over the counter ones to help maybe just alleviate some issues that you have. Again, I'm a huge fan of Dr. Scholl's insoles. They have that machine that you can go to CVS, Walgreens, Duane and Reed, things like that, and stand on it. And it does show your pressure points, and it will kind of give you, a good push forward to like offload it properly, whether you're over pronating, over supinating, and give you something in there. So that's like next step that I would do if you can't get to your podiatrist. The custom orthotics are something that you'll go to a podiatrist, x-rays, scan, mold, whatever that the podiatrist does in that person's office, and then we'll really treat you properly. So if they're having arch pain, heel pain, you'll see if you're an overpronator, supinator. You'll post it properly, take care of the arch, and then every step you take, it's offloaded.
Hmm.
So yeah, I think they're a 10 out of 10. I wear them in every single one of my shoes that I have.
Do you think there's an adjustment period? I mean, because I'm sure it's going to feel quite a bit different when a person first is wearing their orthotics. Is there a period of time where they, excuse me, build up to using them for running, or is it just like straight out of the box, like go 100% of the time?
So you get one of the Dr. Scholl's that's straight out of the box. You can use that pretty much immediately. As far as orthotics are concerned, I like to say it's kind of like a baseball glove. You have to break in that glove before you go out into the game and play with it, and that takes time. So walk around the house with it, walk to the store with it, walk around the mall, whatever, and eventually break them in. You'll know when they are, like it won't hurt you. As far as orthotics are concerned and runners, it's very interesting hearing a runner's take on orthotics. Some people just don't mess with them. There was like a huge thing when I was in school about like barefoot running. So like there's such an alternative approach to health and wellness and fitness amongst like different people. I'm trained one way, and then you speak to another group of people that think you're hokey.
Right.
It's like whatever, do you? That's just my recommendation. So, take it or leave it. I work out a lot, so I definitely practice what I preach, and I work out and run in orthotics and the shoes that we were talking about and things like that.
Mhm.
Do you do that because you had an issue? Like, I think you mentioned,
Morton's
Had that
neuroma.
neuroma.
okay.
Yeah.
So it wasn't just preemptively you were wearing orthotics. It was in response to an issue you were having.
Well, my whole life I wasn't. I was wearing over the counter insoles, and that would always help me. So I'd always put them in my cleats and things like that. Then when I never knew really that orthotics existed, a custom insole in everyone's shoes, but it makes perfect sense. Like if you have flat feet over pronation, you got to lift that up. Like everyone should kind of be in neutral.
So, yeah, I'm
Hmm.
interested about flat feet because actually all three of our sons have very wide, flat feet. And it seems like they each struggle with knee pain as a result of that. And I've tried to get our oldest son to do inserts, but he's like, oh, they're too uncomfortable. So I'm wondering, do you find there's a correlation between people with flat feet and knee pain? And does that kind of go hand in hand?
Yeah, I mean, if that person, like your son, they're not wearing insoles in their shoes, yeah, just everything has a ripple effect. So if they're falling in, the ankle collapses, the knee, hips, back, everything. Now, you can get orthotics that are too rigid. So if you're flat and then somebody's trying to like push that up high, that's going to hurt.
Right.
That's going to suck. So you have to kind of build them up to that. So there's like polypropylene, things like that have not so rigid. Like you can go as far as getting like carbon fiber in there, and then like you really don't collapse at all. Um, I use polypropylene. I just feel like it has good give. Every step you take, kind of like, it's nice.
Do you find that people with wider, flatter feet, do you recommend that they tend to get a certain brand of shoe that tends to be wider and more foot shaped? Because I find like a lot of shoes are fairly narrow,
Like Nike.
and that's of course what the
Yeah,
kids want to wear is the
I
Nikes.
agree.
And like they're
Right.
choosing fashion over function.
Most people do. I don't know. Like as far as sneakers are concerned, yeah, I make sure that I get more comfort. But back in the day, I would always choose, to look more stylish and stuff like that.
Mhm.
So it's just youth.
They have to get through that on their own.
I can
Yeah.
I can imagine that you're wearing Birkenstocks right now, right, Dr. Brad?
I
Oh
haven't.
man, no way. Right now it's so rainy where I am. I'm wearing rain boots.
It's raining here too. We're in.
Yeah.
Oh, he is. Yeah, that's cool.
I don't think he's
Yeah,
gonna show up
I
to the
literally
office
got
in
I literally got
Birkenstocks.
off the subway, and it's just such a mess here. So I just threw on rain boots.
It's raining here as well in central Pennsylvania,
Yeah,
where we
we're
are.
under
Oh,
the same
nice. I'm
cloud.
a I'm a PA guy.
Oh,
Pottstown, Pennsylvania.
oh,
Oh,
cool.
nice.
Wow, yeah.
Born and
Is
raised. Went to
that's where
went to Temple.
Mhm.
that's where Yingling is made, isn't it?
That Yang Lang. No, that's Pottsville.
Oh, okay.
Yeah,
They lost your
everyone.
towns and your bills.
Yeah, right.
Yeah, Pennsylvania is full of villes, towns, and burgs.
Correct. You
Uh,
guys don't throw your O's like I would think.
well, we're both from the West. I'm from Montana. He's from California originally.
Oh,
Yeah.
okay.
And we've
That's
lived
why.
we've lived in the South. We're now in Pennsylvania, so we're a little bit confused on our
Sure.
I
accents.
don't
Don't
know who
know.
I am anymore.
Yeah.
All right, so just two more questions here. Do you have any tips for dealing with corns? This is from Paula. She says, treatment for corns. You just can't cut them out. My podiatrist has recommended Vicks and toe pads. Just wondered what other options are.
As far as corns and calluses and things like that, yeah, you shave them down, you offload. If you're offloading it, you're not putting so much pressure and the skin's not becoming so tough and rigid. Moisturizers, creams, things like that for sure. But there are acids out there to kind of exfoliate that area out. But corns and calluses are usually just because of like an underlying bone foot issue that's causing the skin to build up. So essentially, it's a problem with your foot. And that can be alleviated with, again, proper shoes, insoles, orthotics, things that we were just talking about. That's not the answer to everything. I have a lot of tricks, but some of these questions are all boiled down to that. You know,
Right. When you're dealing with people who are on their feet a lot, putting a lot of, constant impact, then
Yeah.
probably the answer does come down to that a lot.
I was thinking about what a funny name for those things, right? Corns. And then I was watching your program, and there's a lot of food
yeah.
metaphors for
Oh my gosh,
what you're
yeah,
describing on the bottom of people's feet.
for sure. People relate to it so well. So So you try to use your mind and be funny sometimes, but also sensitive.
Right.
So Fritos is a good one for smell, things like that.
There's also some marine metaphors like coral reef kind of looking stuff on the bottom of people's feet.
I had that one. That was a great one. Barnacles on the bottom of a ship.
Yep.
You know, get you to the big time. You got to think of these analogies, man.
That's right. You got to make it relatable.
That's right.
All right, final foot question here. Long distance runners like ourselves, we deal with blisters quite a bit, especially ultra runners. It's all about feet care at that point. So I'm wondering if you can share any tips on how long distance runners can prevent blisters from happening.
Blisters are very challenging to prevent. There are things out there like just moleskin that can really help in those areas. I suffer from blisters a lot when I work out, and mostly in my heel, and they suck. There sometimes I just feel like you're more prone to getting that. I mean, obviously the sock game, you can put There's blister pads out there that are fantastic. You start with stuff like that, from Band-Aids to moleskin socks to cover up the area. But it's friction. I mean, at the end of the day, like, you have to find where your friction spots are and pad it, and offload it. Um, it's a challenge. It is, but there are tricks out there. It's really just finding the appropriate trick for you.
Yeah.
That's what it boils down to.
So it could be, I'm thinking, Trevor, with you tend to get blisters always in the same place. I wonder it's because you kind of have a flattening in that area that tends to have more friction.
Could
you
be.
Where
know.
do you get it?
Right on the
Where
inside
do
of
you
my
get it,
foot.
Trevor?
Yeah.
Okay.
Yeah,
Yeah.
inside of my foot. Like kind of on that soft part, right on the inside.
Right.
Mhm. Yeah.
So, and I think
Um,
it's related. Sometimes I'll wear cheap socks
Or older
because
socks.
yeah, and I'll get it. Or
right.
if my feet get wet, if I'm doing a trail run and have to go through a puddle.
Yes, that's a big part of it for
Mhm.
sure. Moisture in there, that wreaks havoc
Yeah.
on the feet.
And if you're going a long distance, if you start feeling that hot spot, like, stop and intervene right away, because
Mhm.
it's not going to get better. Obviously, if you're running a
I totally
5K, you
agree.
could probably endure a hot spot for a couple more miles. But if you're especially doing an ultra, then you got to take care of those hot spots because
Absolutely.
they will tear you up.
Do you guys deal with a lot of people that ask about like bunions and stuff?
We haven't had a ton of bunion questions, but I think it would be interesting to talk about because
Because National Bunion Day is April 16th, right? The day after the
That's right.
Boston Marathon, coincidentally.
how do you remember stuff like
That's
that?
right. Yeah, that's a good memory there with bunions. Listen, bunions affect everybody. They can be from your family. You can be born with them. You can develop them from improper shoe gear and stuff. So many people are affected by bunions, and that's what a lot of our runners come in with, is that bump pain. And that's pain on the inside of the foot that just pushes that toe over and creates a lot of friction there. And every step that you take, if you're running kind of like on a bump, your whole gait cycle is messed up. So it really affects a lot of our athletes and runners. It's one of like the things that I treat a ton. So I wanted to shine some light on it for sure. And there are awesome treatments out there now for bunions. So like, again, shoes, the insoles, but sometimes you have to just fix it. And nowadays, there are amazing treatment options that you can fix the bunion. It's called a Lapiplasty procedure. So you fix it in a 3D plane. You kind of think about like the Leaning Tower of Pisa. If you fix it at the base, you'll get that tower. No one's going to see it. No one's going to visit it anymore. It's going to lose the tourist attraction, but it's going to be fixed at the base. And that's where our bunions need to be fixed. It can't always be at that bump.
Mm.
So, yeah, there's so many different options out there. Limited downtime. You're back on your feet almost immediately. It's kind of like, knees and hips, back in the day. You used to be offloaded so much and non-weight bearing. Now people are walking these hips and knees almost immediately.
Mm.
So that's kind of like how foot surgery is advancing. And I just think it's fantastic. I'm so happy to like be one of the surgeons out there that does this Lapiplasty or 3D bunion fixation. So surgery is not always the answer, but sometimes it's the only answer. So yeah, you got to get checked out for that. If you have bunions and stuff, get a
And
consult.
and like you said, the good news is that you're getting people on their feet more quickly and not having them laid up as long with these procedures.
That's it. Yeah, we're talking about running and working out and staying healthy. You're not going to be healthy when you have that ripple effect, like you were saying.
Mhm.
You collapse in, it affects your knees, hips, back. Like everything starts with the feet.
Mhm.
It's literally our body's natural shock absorbers. So if you treat them properly and you support them, the rest of your body is going to be better.
Yeah.
100%. Podiatrists all day.
Do you ever recommend foot strengthening exercises for people? Because it is our foundation. And I think sometimes
Yeah,
our foot muscles do get weak because we often, wear shoes like a lot of the day. And, there's a lot of muscles there's in your foot. So what
sure.
is your take on that?
That was the whole barefoot running craze thing.
Right.
It's like I see We just weren't born like that. We were born automatically, and our moms and dads put shoes on us. So I feel like if you're trying to then go back to that as an adult, you were just going to lose. You're going to have so many other issues. The people that really started that, they never put shoes on.
Mm-hmm.
So they were born with that strong foundation. Hey, listen, I don't recommend it. I never messed with that. I heard it. I respected it. Never messed with it.
Like you said, it was a very specific set of circumstances where the Tarahumara runners were able to
See,
do
there you
that.
go. Yes.
Yep.
For
Yes.
sure. And it's
Yeah,
interesting.
they're rock stars.
I visited third world countries before, and when you don't grow up wearing shoes, your feet look a lot different than our feet. You know, the feet are more like hands when you go
Correct.
barefoot all the time. They just have developed so much differently as opposed to if you're always stuck in a shoe. So it is hard to turn back the hands of time as an adult.
Right.
Maybe not realistic totally.
Yeah. Yep. I agree. I agree.
Well, if people want to find out more about you and what you have going on, and National Bunion Day and everything, where can we direct people?
Yeah, so my website, it's www.centralparksole.com, and that's SOLE. And I'm on 85th in Central Park West in New York City. You can find me on Instagram. It's at Dr. Bradley. So I do a lot on that. It's kind of like where I showcase some of the show stuff. And I'll send you those links so you can post it. And, yeah, it's like Lapiplasty, that they're doing great things. Dr. Scholl's are doing great things for the insole game, the shoe gear and stuff. Like I love to rep anyone that's doing great stuff out there, and those things are really changing the game. So I'm happy to be on here and chatting about it.
Yeah.
If you ever need me in the future, let me know.
That's
Fantastic,
good to hear.
Yeah.
I was on your Instagram. Looks like you ran with the Bulls last year.
Yeah. Yeah, I got some slack for that.
Really?
Yeah, for sure. Hey, listen, I love to do any type of extreme stuff. I'm a big snowboarder too. But yeah, running with the Bulls, that was like 10 out of 10.
Like
You have
bucket
to do
list.
that.
Wow. Did you have any close calls?
Definitely do it. Man, you're literally going down the street and it's like you either pick the left or the right. And I thankfully picked the right and the Bulls ran left. But the road's narrow, so there's no wiggle room. And it's not like you can be athletic and avoid them because there's so many people. You're boxed in. It's not even fair. What we're doing, it shouldn't be fair. We're definitely
You're tempting
I could have
fate.
gotten laid out for sure. Yeah, it's 50-50.
The Bulls get to take revenge that one day.
Absolutely. Yes, and they do.
Oh,
Yeah,
man.
it's crazy. It's crazy. But definitely worth it.
Okay, and we're gonna sign Angie up next year.
I don't have a death wish.
Oh yeah. Good
San
luck.
Fermin.
Maybe when my kids are
Yes.
raised.
Yeah.
All right. Well, thanks for joining us on the podcast, Dr. Brad, and sharing your knowledge with us, and keep up the great work.
Yeah, thank you.
Thank you. Thank you both.